have decided not to get any cervical exams, or at least not at this prenatal appointment.
Let's chat about it. So here we have a doula who is not a medical professional, portraying an OBGYN who is a medical professional and not the most flattering light. That's not surprising, but I do want to touch on a few important key points. Okay, so the first point that she makes as the OBGYN in her video is this. Cervical exams are standard practice. We use them to monitor things in these last few weeks of pregnancy. So the truth is, cervical exams in these last few weeks of pregnancy are not standard practice. When someone comes in to get their GBS swab in the last trimester of pregnancy, it's very common for a cervical exam to be done or offered just to get a baseline assessment of the cervical dilation and effacement. No, it does not assess the health of your baby, and no, it cannot tell you when you're going to go into labor. And no, you don't have to have it done. What I've found is a lot of patients want it. I'm a doc who doesn't do them at the time of the GBS swab. And I would say probably 50% of the patients ask me, why aren't you doing an exam? Or I want an exam. And if that's the case, I'll do the exam. It's up to the patient. And OBGYNs do not monitor your cervix with cervical exams. Again, in the third trimester of pregnancy, when you go in for the GBS swab, a lot of times it will be offered just to get a baseline exam, but you do not have to do it if it's not medically, clinically indicated. Now, another point that she makes as the OBGYN in her video is that cervical exams increase the risk of infection, but that's why we use gloves while we check your cervix. The truth is, cervical exams increase the risk of infection during the course of labor, especially after the bag of water has been ruptured. He didn't really clarify that. The bottom line about cervical exams is this. Sometimes they are indicated, but many times they are not. If a doctor or any other obstetrical care provider wants to do a cervical exam, whether it be digitally with our fingers or with a speculum, you can ask why. Why is it indicated? What information will you get from it? And will it change my management? You have the right to ask all of those questions. And we have a duty to answer those questions. And finally, people on this app and on social media in general make it sound like OBGYNs are literally chasing patients down with a glove on our hand and our two fingers out, finding any reason to check someone's cervix. And that is simply not the case. But if you do find yourself in that situation, it's okay to find a new doc. Like and follow me here on TikTok Baby Doc for more information about pregnancy, high-risk pregnancy, and childbirth.